All right, so first off, what are we doing here today?
Well, we're here today to encourage people to take action to contact their legislators to encourage them to support Medicaid expansion as part of the state's 2019-21 budget. Governor Evers had unveiled a plan that would have Wisconsin join 34 other states in expanding health insurance benefits through taking advantage of the federal funds for Medicaid expansion. It's important for several reasons. First, it expands access to additional individuals. In the 1980s, I had the opportunity to serve in the state legislature as chair of the health committee. We were wrestling with the issue of uninsured and access to health care. Unfortunately, we've made little progress since then, and the proposal that the governor introduced would have expanded health care access to 82,000 Wisconsinites and over 1,600 people in Marathon County. It's important for business and for people to have that access expanded. Businesses benefit because we avoid cost shifting of the cost to the insurance policies that they fund, and individuals benefit by also avoiding that cost shifting and by having access to health care earlier in the health care system. What happens now is that people without health care delay their accessing health care, and they tend to go in when the care is urgent and required instead of preventative health care cost. And by expanding health care access and having policies in place for those individuals and encouraging them to take that preventative health care, we are increasing the cost of health care and impacting the outcome of that. This budget bill would result in $325 million of savings to the state of Wisconsin. That $325 million could be reinvested into issues like crisis management, expanding access to or more dollars for nursing homes and physicians to get them to provide care to people that are low income. It will expand behavioral health services, lead poisoning, and a number of other services that will improve the quality of life for residents in the state of Wisconsin.
Thank you, John. The Lincoln County Board passed a resolution in favor of the Medicaid acceptance by the state, and we did it by voice vote. It was recorded as unanimous. A few years ago, a former county board member sponsored a resolution to create a non-binding county-wide referendum on the question of Medicaid acceptance, and it was put to the voters, and it passed by in the range of 65 to 70%. I don't remember. So in addition to John saying that we hope people will contact their legislators, we want the citizens, people who listen to and watch this newscast, to realize that the citizens have voted overwhelmingly, not only in Lincoln County, but in other counties around the state, for this Medicaid expansion. And obviously the legislators are, needless to say, not listening. And maybe Channel 7 and Channel 9 will get them to listen a little bit. In addition to the whole issues that John spelled out in regard to individual persons being able to access better health care, we also have, as you do in Marathon County, we have a county-owned nursing home. And we have roughly 70% of those residents who are on Medicaid. If for every Medicaid resident that a county-owned nursing home takes, the county loses money on them. This will be true, I'm sure, as well for Marathon County as it is for Lincoln County. And in accepting some of this, all of this Medicaid money from the feds, I don't know what percentage that might lift the nursing home reimbursement, but it certainly would help. And county homes, for people who don't know, private nursing homes limit the number of Medicaid residents they will take. Sometimes it's as low as 20 to 25 or maybe 30%. Counties, because of their mandate to take the residents whom they need to take, are up in the 70% range. So there are lots of reasons why the legislature should suck it up, listen to the people, and accept the federal Medicaid money.
So what I'm hearing from both of you is this has got, to a certain extent, it's got bipartisan support. Is that correct?
Not as much as we would like, and it is 62% of the Wisconsin residents support Medicaid expansion. 34 states have adopted Medicaid expansion. The legislature chose not to endorse or include the governor's proposal in the budget, but rather deal with it incrementally and While there are modest changes, it has not resulted in the acceptance of the dollars that will leverage additional funding that will result in investments in Wisconsin.
And then, for one thing I've heard people say is this money is actually money that Wisconsinites have already paid in to the feds as part of your federal income tax, right? So it would just be Wisconsin getting some of that money back.
That's correct. We would be capturing or leveraging through the expansion federal dollars to increase reimbursements to physicians, to other healthcare providers, to hospitals. Some of the rural hospitals that are suffering would benefit from this proposal.
Why is it important for you to be out here and to make this push, make other people aware of this?
This is the critical week for this issue as well as the budget. The Assembly and the Senate will be taking up the budget this week, so it is imperative that if people have concerns about this, to contact their legislators today or tomorrow to indicate their support for Medicaid expansion as part of the 2019-21 budget.
One of you asked a question about whether it's bipartisan. Since we passed this resolution by voice vote unanimously on the Lincoln County Board, I have a big doubt as to whether it's all one side or the other. I think so, yes, at the Lincoln County level, it was very definitely bipartisan. And there's no question that the squeezing that the legislature and the former governor has done on counties, including Lincoln County, certainly roads would be an example, has moved the people who would tend to be Republican on the county board into a far more critical perspective of what the Republicans are doing in Madison, both in the legislature and the former governor. So there's a growing sense of unease at best regarding how the legislature is operating. I had another point to make, and I'm getting to be an old man and I forget what it is.
But this is not a partisan issue. This is a people issue. It is the issue of who has access to health care, at what point in their illness do they have access to health care, and can we avoid cost shifting to those that do have insurance. So this is a common sense approach to try to capture those federal dollars, to expand access, and to improve the quality of life.
And we've passed resolutions both in regard to Medicaid, we've passed them in regard to roads, we send them to our legislators and we don't hear anything back from them. Apparently they feel immune because they are protected by gerrymandering. And so gerrymandering figures into this discussion as well. And the legislature, we passed written by my colleague Hans Breitenmoser, we passed a resolution that went on to a non-binding referendum for the entire county again this past November, and that resolution passed in the county by 65%. That is to say, people voted 65% in favor of a nonpartisan redistricting process. And so part of the reason we're in this Medicaid pickle now is because of the gerrymandering. So all of this stuff ties together.
Good if you are.
Anything else that you guys just wanted to say?
The Marathon County Board of Health has taken a stand in support of the Medicaid expansion. The Marathon County Board will be discussing the issue in July.
Thank you guys.
Thank you very much.
I'd like to ask